called Bridging the Information Gap. I'm joined here by Anas Abu, who is a Project Development Executive from the Muslim Charities Forum, and Ahmed Uddin, who is Head of Programs, also at the Muslim Charities Forum, and Carly Ziska, who is our Senior Learning and Development Coordinator here at RedR UK. So some housekeeping rules, as I just said. If you're as a participant, if you can mute your mic, that would be great. Thank you very much. And because that will obviously help us in terms of background noise. So the session today is going to be roughly about 45 minutes. And there'll be within that about a 15-minute session at the end for question and answers. If you have any questions, please do. There is a chat box. I don't know if you can see that in the bottom of your screen. It says chat. If you open that, then you can put some questions in there that we will field a bit later for you after the speakers have done their bit. Hope that's okay. So I wanted to give a bit of a presentation about RedR UK. Some people might not understand what RedR means. It's Registered Engineers for Disaster Relief. We've been around for about 40 years now. We second people overseas, or that's how we started, and we were engineers, recognising the fact that engineering capability was very useful in disaster response, and is still very useful in disaster response. We do a lot of work at the moment, more work I think, around training people and organisations to be ready to respond to disasters. In the past, we've responded to the Ebola outbreak, and where we sent people overseas, or we prepared people going overseas to Ebola affected countries with pre-deployment training. We've also worked obviously in around water and sanitation hygiene, looking at things around cholera responses, for example. Also worked in conflicts such as the Syria response. We in fact have a Jordan office that works in and around the Syria affected countries. And last year we responded in Cyclone Idai in Mozambique, working with organisations there. So over the past year, we've trained more than 4,000 people in 32 countries. So that is a huge amount of people that we've trained. Most of our training is face-to-face training. So you can see how COVID-19 has had an impact on what we do and how we work. And so some of that I think will come up today in what we're doing and how we're addressing that. So I think I've just presented everyone anyway. So I just wanted to then go on to what kind of the overview of the international situation is at the moment. I mean, it's pretty horrendous, actually. I mean, I looked at the statistics this morning, 1.9 million confirmed cases of coronavirus, of COVID-19, and about 120,000 deaths. Though obviously only confirmed cases, there will be a lot more out there that have not been tested and are unconfirmed. For us in our Sudan office, Sudan have had another 10 cases notified overnight, and that takes their caseload up to 29 cases. So it's had actually a bit of a spike over there in Sudan, so that's something we're watching very carefully. In Jordan, they've already had 391 cases, and again, both countries are in lockdown to some extent. Just to give you a flavour of what that means for operations, humanitarian operations, you know, an outbreak of COVID-19 in healthcare systems in countries, in developing countries in the global south will be absolutely catastrophic. If you can think about what we're going through here now in the UK and how it's affecting our healthcare system, and then transfer that overseas, you can see why that is an issue. Again, another issue is around the economic impact of lockdown, the impact on livelihoods, especially for women. That's something that will also come to fruition in a huge, well, actually already is in international context, and indeed here. COVID has a possibility also of kind of breaking down social cohesion, where people are fighting to fulfill their basic needs. There'll be an increase in domestic violence. We're already seeing that here, notably against women and girls, and that's likely to occur overseas. And the gap between rich and poor will widen further. So this COVID has the possibility of putting kind of real major setbacks on development gains over the past few years. And so we therefore obviously want to try and prevent that happening. I want to introduce our next program. This is thanks to the WhitbyBird Foundation for their funding on this. This is a first for us. We recognise that there is a challenge in the UK around COVID-19 and the messages that are getting across. And so what we wanted to do this time is respond in the UK, and for it to have a knock-on effect to countries overseas where there will also be a need for the right messages and to kind of address the infodemic that we've got, so that people are getting the facts on a global, regional and country level, and that they're adapting, they're changing, and they are actually meeting the right kind of audience in the right kind of way. So what are we looking at in this webinar? So this is aimed at organisations, community leaders and people who need support in being quickly trained to respond to COVID-19. So this webinar will look at the new free training opportunities that we're going to give courtesy of the WhitbyBird Foundation, and then how to train others. So this webinar is not the course in itself, but that will come afterwards, and then we'll guide you through the right tools and the next steps. So back again to our speakers for the day. Carly Ziska, Senior Learning and Development Coordinator. She's going to explain what the information gap is in the UK and what RedR is doing to address them. And then over to Anas, who is explaining what the needs are in Muslim communities in the UK and why they decided to partner with RedR. And also then Ahmed Uddin, who is Head of Programs at the Muslim Charities Forum, to focus on how they go on and train others to prevent the outbreak. So, over to Carly.
Great, thanks, Joe, and hi to everyone. So I'm Carly, I'm the Senior L&D Coordinator at RedR. I want to talk just a little bit about what the need is from our perception and kind of what RedR is doing in this space. So, as we know, people are exposed to a huge amount of information in the UK and abroad. We know that most of the communities that we're working with in the UK get their news from sources like the BBC, but also, about 50% of us get information from social media, and that represents a huge and unregulated source of information. And so it can be really difficult for communities to know what's out there, what's true, what's not, which sources they should be listening to, what things they should be disseminating to their family and their friends, either in the UK or abroad. And so we are really looking at a way to kind of cut through a lot of that noise and direct people to the right resources and the right languages that have the right information that will be relevant to their communities. And one thing that Joe mentioned is that from RedR's humanitarian experience overseas, we know that information absolutely saves lives in a very real sense, and a lack of information is one of the biggest contributing factors to loss of life. And so what RedR is looking to do is pretty revolutionary for us because we do a lot with face-to-face learning, and so we're taking our expertise in that space and we're moving it online. So what we've done is we've designed 3 training modules that are completely free and are available online. They are aimed at community mobilizers, humanitarians or development workers, healthcare workers, faith communities, anyone who is working on the response in the UK, but also are open to an international audience as well, if useful and if relevant, absolutely. So I'm going to talk you through a little bit about what goes into the modules. And so there's 3 separate but linked modules. So there's one on hygiene promotion. So the first thing we're looking at is prevention measures. So how to reduce transmission in the UK, like what effect does social distancing have, how to disinfect surfaces, but also how to care for family members or care for others who might be showing symptoms. And then thinking about what are some of the barriers to implementing some of those measures. So that could look like a lot of different things in a lot of different communities. The second thing we're looking at in that module is hygiene promotion for carers or caregivers and anyone who is working with others, either taking care of family or taking care of relatives, neighbors in a public health space. And so how to reduce the spread within households, so households living together, or between households, so households who share common spaces but maybe live separately, and so how to reduce the spread there. And then the third thing that's in that module, which I think is really interesting and important, is how to talk to children. And so there's quite a distinct element around messaging for different ages of children and what kind of things they might want to know about transmission, what kinds of things are digestible and accessible for them at different age levels, and how we can kind of engage with them as well in a non-threatening and kind of accessible way. So that's a hygiene promotion. There is also a module on myths and myth busting. So we know that there's a ton of misinformation right now that's on the internet and on TV, and that people are getting through WhatsApp and Facebook and all of these various channels. And it can be really difficult to know what's true. And if someone share something with you, it can be really difficult to know if you can trust it or not. And so one of the things that we're looking at in that is what are the common myths within the communities that we're working with. And we know that there are specific myths that are specific to certain communities. And so we really want to dive deep into, for a particular community, what is the context that we're looking at and what kinds of things are they hearing. There's also a aspect of where do these myths come from, so how can we identify what these sources are and work against them. How can we address stigma? There's quite a lot of stigma around different communities, different elements of society around like where the spread is coming from, or who we're interacting with in our day-to-day lives. And so there's a big part of how to combat stigma in that. And then also, what are the trusted channels? So where do you go for information? How do you triangulate information if you're hearing it from one source and you don't know if it's true? How do you fact check? And then how do you kind of combat if you're hearing myths? What do you say to someone who is disseminating information that you know is not true? And then the last module is around mental health and psychosocial support. So it relates to a few things. It relates to stress and anxiety of people experiencing symptoms, but it also relates to stress and anxiety for anyone who is caring for someone with symptoms or who is dealing with stress because of a knock-on effect of COVID, whether that's being out of work or whether it's being anxious about family abroad or domestically. And so we're looking at what is stress and how to identify it, why do we react the way we do, wanting to understand that our reactions to stress around COVID are completely normal, how to manage that anxiety, so positive and negative coping strategies, which look very different depending on like the cultural context that we're in, and then how to use something called psychological first aid, which is how to support someone and yourself who's going through a bit of a hard time. So those are the three modules, and then there's a really, I should say they can either be all taken separately, you can take all three. They are very much related, but people do not need to take all three of them. So if there's one that's more relevant for a particular organization or a particular individual, that's absolutely fine. One really exciting piece of this, and I think really speaks to the community mobilization and the accessibility piece, is around translation. So each module is delivered in English, but each module also has key messages within. All right, I think I was muted there.
Yeah.
Yes, today this morning 9 o'clock. And I didn't sleep because nowadays
Unmuted at all.
Upside down.
Everyone's unmuted.
Cross-lined.
Yeah.
Okay, I'm just gonna keep going here. So one really interesting part of the program is about translation. So every every module has key messages that relate to the module content, and those key messages are translated into a variety of languages. So Arabic, Urdu, Bengali, that are really relevant for migrant communities, diaspora communities, and are messages that participants can take back and disseminate to their communities. So we know that, language barriers are a huge problem in accessing information, and for people living in the UK where English is their second or third or fourth language, or where they don't speak English, we know that messages really need to be tailored to communities, and they need to be in the languages that they speak and that they interact in. And so that's, I think, a really cool part. So each module is 2 hours. People can register on the links on the RedR website, which I know we'll share, or on social media, LinkedIn, all of those. They are standalone, but they can all be taken together. We start courses on the 16th, which is this Thursday, which is exciting. They're all really interactive, so it's not like a lecture. They're all, there's case studies, and there's discussions, and there's activities to all of them. They're all facilitated by RedR facilitators who are experts in their fields. So they're all humanitarian and development professionals, and they're all experts in not only the content, but also in, working with communities, and everything has been tailored to work online, but still kind of have that participatory feel that RedR courses have. And then each course is also accredited by HPAS, which is an initiative that accredits training providers like RedR. So you know that you're getting a really quality course, and people get badges through HPAS that you can put on your LinkedIn or on your CV to say that you've completed it. So it's almost like an electronic certificate to say that you've completed the course. So I am gonna stop there, and I'm absolutely happy to answer questions about the content or the modules that we've developed, or kind of our plans there. So happy to do that at the end. Please pop them in the chat box. I am just going to hand over to Anas, who's the Project Development Executive at the Muslim Charities Forum, who is just going to give you a little bit more. So thanks.
Thank you, Carly, and thank you to the RedR team for organizing this webinar. And to give everyone a brief introduction of the Muslim Charities Forum and what we do, who we are the network of British Muslim charities, the umbrella body, to look after and support the sector. We do that for a number of different ways, through supporting it with training, through connecting it to the right people, as well as researching it to develop it and celebrate its success. Of course, as RedR mentioned, COVID-19 has completely turned things upside down for a lot of people, including ourselves. So we completely stopped our pre-COVID activity and transformed to support the sector in this difficult time. Now within the Muslim community and within the community as a whole, within the UK, I'm sure everyone may know that the response by civil society, the response by charities, the response by community groups has been incredible. Within our community, we've seen a number of mosques, community groups, and large international charities hunker down and support their local areas, often working in partnerships with each other and also with the wider civil society, with churches, with other faith groups, and to really kind of bring home and support their communities in this difficult time. For example, there are a few large sort of INGOs who are used to working in disaster situations abroad, who are now actually supporting some mutual aid groups in the UK to help them respond to this disaster in the UK more effectively. We have restaurants providing meals, we have charities supporting groups with their volunteer bases, we have mosques using their local knowledge of their community to ensure measures are effective. Not only that, not only are they helping sort of the physically vulnerable individuals. There's something important that everyone should know, that there are a number of individuals, a number of groups in society that still need help, and more help in this time, such as the homeless, refugees, asylum seekers, victims of abuse. And of course, you have key workers who are working all day pretty much, who need support and support with meals at the end of the day. And some charities, for example, are also providing PPE equipment, where the government sadly have not quite been able to be as quick on that. Now, of course, the worry also with this is that we want people to go out and support their communities. However, we don't want them to unknowingly pass on the virus whilst they are helping others. And this, we think, is the main need for sort of training like this, to ensure that those who are well-intentioned, those who want to support others, ensure they know what the right precautions are, they ensure they have the right information regarding COVID-19 to make sure that they don't pass on the virus whilst volunteering. And so we think more is needed to ensure that they are safe when they are helping. And that's why we think this training is valuable for a number of different community groups, charities, mosque leaders, whatever, to use this training in the UK, and I'm sure around the world as well, to make sure that they support those in need effectively. I will now hand over to my colleague Ahmed, who will talk a bit further about this. Thank you.
Good afternoon, everyone. Thank you for having me on today. A little bit of background in terms of how the Muslim Charities Forum has responded to the COVID-19. We realized that many of the, as Anas, my colleague, mentioned, many of the organizations around the country have responded. We realized that there was a high level of duplication of work and very little collaboration. So what we tried to do as a first for the Muslim Charities Forum was to get a coalition of Muslim charities around the country to kind of collaborate. And as a result, on the back of that, with consultation with these charities, they've mentioned that there's a couple of streams of work that has kind of come up as urgent. One was that the members of the community are struggling with finance. So, as you know, people have lost jobs, people who are on 0-hour contracts, people who are taxi drivers or self-employed aren't in a position to go out and work anymore. So MCF, the Muslim Charities Forum, has launched this initiative to raise funds for hardship. And we're doing this through our own fundraising appeal, but also through the networks that we have. Like, we've got connections with private foundations, other bigger charities who are willing to give grants to individuals who are in hardship. So we're just coordinating that. And we also realized that the grassroots organizations that are responding are currently struggling with the response. So, for example, a charity like the Muslim Youth Helpline has had a very high level of calls because of the mental health issues that they're struggling with the lockdown. So resources are very limited and very stretched. So we are trying to support these community organizations to be able to respond properly with resources, both financially, but also with the volunteer support and expertise. And also through these consultations and meetings with the community, we realized that there is massive gaps in knowledge, as it was mentioned earlier on. So we've run a couple of webinars where we are talking about, for example, furloughing, how even also Muslim charities who tend to hike their activities in the month of Ramadan, which is literally about 10 days away, how to be able to respond to the work internationally and both nationally here in the UK. So we are collaborating with various charities to see how we can actually pull resources together. And so that there is more efficiency, but also the most vulnerable are reached in this time. We also did a seminar around volunteering. So how can you volunteer in a safe way where you're not contracting it, but also not passing it on to others if you are a carrier? What we are trying to do with this, with the information that comes through RedR and through any other kind of knowledge base, is with our networks, be able to reach out to the charity heads, the community leaders, the mosques, the umbrella organizations that are within our networks, and to be able to kind of provide training to them so that they are able to go back to their constituents and be able to pass on the knowledge. And that might be in the appropriate language, in a language that's kind of as their mother tongue, or be able to kind of translate material in a format that's more accessible for individuals. With the lockdown, it means that a lot of mosques are closed down as well, which tends to be the hub of the community, where Muslims are trying to go there 5 times a day to pray, and a lot of information gets passed on within these venues. But as due to lockdown, especially Friday prayers was an important place for the congregation to come together to be able to pass on knowledge.
How do you stop at the end?
And as Islam is a religion of a communal gathering, a lot of activities, especially with Ramadan around the corner, many people won't be able to kind of congregate and pass knowledge on, and so it's these webinars that we are able to reach out to the various sections of the community and pass on this information. And the other issue is that disproportionately high level of BME people are being affected. And so to make sure that this spread isn't accelerated in the coming days, because we are reaching the peak, we need to pass on this information urgently. And as a result of COVID-19, many people from the BME community are dying as well. And there are kind of religious sensitivities and cultural sensitivities around burials. So we are coordinating a lot of activity around this, and passing on knowledge around how to kind of coordinate burial activities during this period whilst being safe and sound. I think that's from me. I'm going to just pass it back to yourselves.
Thanks all. I think this is over to me again now. Really struck by that last point from Ahmed, just around how Black Asian minorities are affected. And there's something I read yesterday saying that the Black and Asian minority ethnic minorities in the UK constitute 14% of the UK population. However, 33% of people who have contracted or confirmed cases of coronavirus are from that community. So they are disproportionately affected, which I guess is why, it shows why this kind of work that we're doing is vitally needed. So I'm going to start taking some questions now, and so bear with me a second. So I'm going to pass this one over to Carly, probably. In fact, a lot of them are actually addressed to Carly. Can the courses be attended outside of live delivery times, and are they free?
They are free. All of them are free, 100%. So through the generous contribution of the WhitbyBird Foundation, they are all free. There is absolutely no fee to register or to attend. So just want to make that 100% clear. They can be attended outside of the live times. So we are going to be recording all of the training courses, all of the modules, and those recordings will be available for download for the participants or for people who couldn't attend. That will be most of the content. There will of course be some activities or discussion groups that you wouldn't be able to participate in, because obviously those discussions will be live. But there will also be resources that are associated with each module that can kind of supplement that, and those will also be available for people to access for free.
Great, thank you. A lot of questions here about whether the course is targeted to the UK, and I think that is where we are at the moment. But maybe, Carly, you want to explain what we're aiming to do in an international context very soon, which hopefully would help answer some of these questions.
Yeah, absolutely. And I think it's something that we are actively thinking about and actively developing, because we know that it's not just a UK issue. So while this is our first sort of foray into online modules around COVID, we are also developing them for an international audience. So working through our partners in our office in the Middle East and then also Sudan to kind of think about East Africa as well. And we know that there are, as I said, you know, talking about the modules, we know that context specific information is hugely vital. And so something that we tell someone in the UK is not relevant for someone in Syria, is not relevant for someone in Sudan. And we are hugely aware of that. And we know that it's a gap that needs addressing. And so modules and you know, learning resources that we're developing in other regions are absolutely tailored to those populations. And so we're working on these modules. We're using like the latest guidance from the UK government and the NHS. And then we're also developing some internationally, able to be used internationally, courses that will be contextualized. So this is the start, and we're just expanding from there.
Great, thanks, Carly. Some questions here around the languages. We obviously talked about the Black and Asian minority ethnic communities. What languages is it anticipated you will translate the courses into, or the materials rather?
So we would love to get them in as many languages as possible. We're right now looking to start with Arabic, Urdu, and Bengali as sort of our first languages that we're looking to translate. But we are also wanting to translate them into quite a few others. So maybe Punjabi or Gujarati, and then maybe different dialects of Arabic. So to be honest, the sky's the limit. We're looking to have the messages in as many languages as possible, so that as many communities can learn from them and can access them. So if there are languages that people think would be useful, or if you can help us out with translation, please feel free to send us an email. I would love to talk to you about that.
Great. I think we'll also look to work with an organisation called Translators Without Borders around that, and they should be able to help, which is really good. Again, probably another question for you, Carly. Is there a limit on the number of people who can participate in the training?
Yes. So in order to keep the group very interactive, and in order for the facilitators to be able to answer everyone's question and manage the time effectively, we are capping the courses at, I think, 20, but we are running a lot of them. So we know that people are, working, and so there are some that are offered during the day. There are some that are offered in the evening, so after working hours. And there are quite a lot of them. I think we have at least 6 scheduled right now for each module, and we're just going to add more if there is more demand. So you can feel free to register online. We'll share the link for where to register, but it's on our website and on our social media. And so we'll run as many courses as there is demand for. That's
great. That's brilliant. Thanks so much. There have been a few, and I've noted on the chat here that there's interest here from Somalia, Somaliland, Sudan, and Nigeria. How would you? And they're all raising questions around, contextualized materials and training for them. How would you suggest, given that we've obviously already talking about working overseas, how would you suggest they engage with us about looking at the needs in their locations?
So I think a really good point of contact would definitely be ourselves in the UK, because we liaise with our overseas offices, but also our office in Sudan would be a really great point of contact as well. I think there's a lot that we are coordinating with humanitarian actors internationally, including like the WHO and quite a few working groups, and then some of our local partners on the ground, so very small NGOs on the ground who are collating you know, these myths and these this misinformation that they're hearing and how to combat that. And so we're looking to do quite a few unique things in context-specific locations. So like Sudan, we're working through TV or radio. In MENA, the Middle East region, working through local partners who are still interacting with populations on the ground. So I would say that the best point of contact, you can absolutely email me, and I'm happy to share my contact information, and we'll put you in touch with either our Sudan office, or depending on where people are, we can coordinate that. That's not a problem.
Great, thanks for that, Carly. So there's a question here around mental health and psychosocial support. Also one around, will there be any support for how to return to work in an effective or in a safe way?
So there is a module on mental health, and their psychosocial support will absolutely be part of that. And so that's, you know, psychological first aid for people who are carers or who are caring for family members, or people affected with symptoms, or but also quite a big emphasis on self-care. So that will absolutely be included. We are, right now, there's not a module on returning to work, only because there is not any guidance from the UK government on when that will happen. And so I saw, I'm just going to skip to one of these questions, because I saw one about updating the courses. And so I think that's something that we would want to look at when that guidance becomes available. So we are not looking to reinvent the wheel in terms of like inventing new messaging. We are using what is available from, you know, a lot of really trusted sources like Public Health England and the NHS and the UK government. And so when that guidance on returning to work safely becomes available, and when we have a little bit of guidance on that, I do think that we could incorporate it, because one thing that we are doing is we want to be constantly updating the modules when there is new information that comes to light. And so we're kind of constantly monitoring that, and when there is anything that's new, or any new guidance from those sources, we'll definitely be updating them.
Great, thanks for that. I also want to add to that around the resources that we're looking at and how we are collaborating and coordinating with the international community. So a lot of the work we're doing now is around community engagement, and we are actively involved in the community engagement initiative. We are working with the WHO. There's a new thing in the UK, courtesy of the London School of Hygiene and Tropical Medicine, which is called the Hygiene Hub, which is basically going to have lots and lots of information around there from around the world in terms of resources. We'll be collaborating and putting our courses on there, also looking at other ways of getting those courses out to the wider population, really. So if you have any other suggestions on which way we can do that, that would be great. I don't know if I've missed any. Does anyone else see any other questions that were in there? Okay, look at this one from David Curtis. We're getting info into, says, are we also getting into accessible formats for persons with disabilities? And some issues need tailoring for people with disabilities, also in our context, such as social distancing, and they are in Southeast Asia. We do a gender, age and disability course. I wonder whether that's been looked at within these, you know, as one of the kind of constituent audiences there around people with disabilities.
Yeah, I think it's we are definitely wanting to look at, because there are, number one, it's something that RedR does quite a lot, and populations like older people and people with disabilities, who we know have really unique needs in humanitarian situations. So it's actually something that we've been talking to a few partners about, how to incorporate that messaging, and it is one of the things that we want to look at in sort of a future iteration of the module that we're talking about now for carers, so people who care for people with symptoms, and then specifically tailoring that language to populations with really unique needs. And so I would actually love to have a conversation with someone about that. Look at how many connections we're making. This is amazing. So feel free to email me and I will talk to you about that.
And that's great about this, even whilst I'm looking at these questions here and I'm going, okay, actually, and then there's Celestine here is talking about anything focusing in refugee camps, which is actually a cloudy area. As Carly said, that is something that we're looking to do next, and we're trying to get a proposal together for that, or we actually have a proposal and looking at how we can do that in international context as well. And so I wanted to hand over to just ask Anas and Ahmed if anything has struck you amongst those questions or anything you saw there that you think you could add that would be good for our audience here. I put you on the spot, didn't it? Sorry.
Nothing from my end, to be honest. I think everything's been covered very effectively by Carly. So,
yeah, from my end also. And I would also share that like a lot of our member charities as well are the big NGOs are looking and strategically looking how they can replan their international programs in a safe and effective way. So definitely that's something that will be needed to support with. But that's all. Thank you.
I'll unmute myself. That also always helps in this kind of forum. Okay, so I think we're done with the questions for the minute. I think that's great. Thank you so much for submitting those. And I do hope you have received some good information, are looking forward to the training courses. We are, as Carly said, we've recorded the session and that will be sent in by email. And if you subscribe to our newsletter, if you go to our website, redr.org.uk, you can subscribe to our newsletter and you'll get lots of information about what we're doing in this. Also, follow us on social media. We're on LinkedIn, Facebook and Twitter, where all promotion about the courses will be put out. So if you sign up there, you'll definitely get the information first. Thanks to the Muslim Charities Forum. You can find more info about them on their website, which is muslimcharitiesforum.org.uk. As I said, all materials afterwards will be available for you guys afterwards and after you've taken the course, and hopefully in the language that is appropriate to your needs. And so I want to say, stay safe. Training saves lives. Thank you again to the WhitbyBird Foundation for their money to help to do this. I think that by doing this, we can not only help prevent greater transmission of COVID within the UK, but also help overseas. So thank you very much. Thanks for joining. Take care and stay safe. Bye.
Thanks, everyone.
Thank you, everyone.
Thank
Bye.
you. Thank you.
thank you.
Thank you.
Thank you.
Thank you so much.
You're welcome.
Thank you so much.
Thank you very much.
Thank you from Kigali, Rwanda.
Oh, Kigali, well done.
Yeah, thank you.
You can send some information to Kali, yeah.
Thank you from Zambia.
From Zambia too. Okay, we've got lots of countries.
Thank you
from Switzerland.
From where, sorry?
From Switzerland.
From Switzerland.
Thank you from Sudan.
Yeah, we have an office in Sudan, so we should be in touch.
Thank you from Sudan too.
Hey.
Thank you from Lebanon. Hi, I'm Abdullah.
Thank you from Sudan.
Living in Saudi Arabia.
Thank you so much from Nepal.
Nepal, okay.
Hello.
Hello.
Hello, Abdullah from Sudan.
From Sudan. Thanks, Abdullah. Thanks for participating.
Yeah, hello.
Hello.
Hello, this is Mubarak from Somaliland. Thank you.
Hi, Mubarak from Somaliland.
Hello, this is Ahmed Suleiman from Sudan.
Great. Thank you very much for participating. Great that you've all had a great time, and thank you very much for the thanks. We're going to end the meeting now. So just a last goodbye. Take care.
Bye.
Bye.
Bye.